Well, growing up in Ames, my interests in high school were computers and sciences. The computer era was just beginning then. When I went to college, I started taking a pre-med curriculum, and Dr. Bill McCormick here at McFarland Clinic, pediatrician, kind of took me under his wing and encouraged me to head to medical school. So I said, why not? I kind of figured I was preordained to head into a surgical field. I'd love to work on my beat-up car, and I thought I had a good appreciation of three-dimensional anatomy. After I went to University of Iowa for medical school, I then went to the Mayo Clinic in Rochester for 5 years of orthopedic surgery training. And then I headed to Boulder, Colorado. I took my young family to Boulder and set up orthopedic practice there. But after 7 years, I got a call from orthopedic department at McFarland and said, yeah, you should come on home. So after 7 years, we packed our bags and came back to Iowa and haven't looked back since. Working as an orthopedic surgeon at McFarland Clinic has been fabulous. I've been able to take care of high school athletes and college athletes, honing my sports skills in orthopedics, and then it's been very gratifying that I've been able to transfer the quick recovery and the limited surgery and getting people back into action quicker, been able to transfer that to my joint replacement folks. And over the years, I've been able to get joint replacement patients back into action quicker and quicker. I frequently get sent pictures from my patients who've had total joints showing me what they do. They're always thankful they're able to re-engage in normal activities, but they're also able to engage in some fairly strenuous activities. And this photo shows two of my patients showing off their total joints on Ada Hayden Lake with some pretty amazing stunts. I've been blessed with working in a great department of orthopedics at McFarland. There's many delightful nurses, techs, receptionists, many of which have worked there for many years, and some even longer than I have. And I couldn't ask for a better group of skillful orthopedic surgeons as my partners. I've been honored to see and take care of hundreds and actually thousands of Central Iowa patients. They all have something to say, they have a story, they have a history, and they always have something to teach me, so it's been a great place to practice orthopedics. I've been asked what I like best about my job, and it's twofold. First, I really thrive on the intense focus that's necessary in the operating room. When I work in the office, I'm usually juggling 8 things at once, but in the operating room I have one task at hand: to be prepared for the procedure, to be prepared for the unexpected, potential pitfalls, the workarounds, and it's important for me to be an efficient member of the operating team. I've had a goal all along of trying to make complex cases simpler, and that's good for the staff to help me out, and it's good ultimately for patient outcomes. The second most gratifying and satisfying part of the job is, I think, the ability that I've had to gain the mutual respect and affection with all of my staff and all of my patients. Each one is quite special to me. And as I head into retirement, it will be the everyday connections that I miss the most.